do doctors take commission?
This is really a very blunt question you have asked. When we graduate in medicine, we are administered an oath, what is known as Hippocratic oath, which means that our all interests are less important than the patient's welfare. The patient's interest is above everything. That's what we are taught before we start our clinical practice. We are also taught ethics, that in ethics, we have to maintain the autonomy of the patient. Patient has to make decision about his treatment. Secondly, we are not to harm the patient with our action. Thirdly, the patient has to be benefited with our clinical skills. And fourthly, of course, we have to administer justice to the patient as far as disease or the problem is concerned. So armed with these ethical issues, ethical principles, we enter into private practice or we enter a government job. A person, say for example, a surgeon who has recently passed out and he has topped in his class and he is a very bright clinician. But once he enters the market, people don't know him. They don't know about his credentials, about his ability to perform surgery. So he has to depend on someone to get the patients. So what he does is that he meets the local practitioners who are working in that particular area, because the general practitioner is the first contact for the patient. And from there only they are referred to the specialized doctors for further treatment in case they require it. So these specialists heavily depend on the general practitioners for getting patients. Since the general practitioner is favoring them, why should he favor? He should have some benefit out of that. So if he's taking benefit from that, you may call it cut practice or you may call commission, whatever name you may give. But this is the reality. This happens. But is it ethical? The question is this. See, according to the ethical guidelines, the patient's interest is above everything, means the patient should not be harmed in any way. That if the patient is referred to the appropriate person, if the general practitioner feels that yes, where I am referring the patient is an able person and he will definitely help the patient in ameliorating his problem, in that case, of course, it is okay because the patient's interest is not harmed. In the bargain, he gets benefited. That is a different story altogether.